Healthcare in the U.S. is hurting and needs triage. Hi, I'm Scott Olson, founder of Smart Care Triage, and I'm seeking a $100,000 investment for 20% equity of my company. The future of healthcare is in our hands. The healthcare industry in the U.S. faces many challenges, including the overutilization of emergency department visits, which causes frustration, waste, and increased costs in the healthcare system. And the demand for emergency care is estimated to double over the next 10 years. I have a solution that will mitigate the emergency care personnel shortages and improve the financial impacts by placing patients with the correct care at the correct cost. First, let me explain the current problem in emergency care. U.S. hospitals experience approximately 136 million emergency room visits annually. It is estimated that 30% of all emergency department visits could be treated at an alternative site such as a primary care office, clinic, or urgent care facility. Furthermore, emergency rooms are often saddled with an average wait time of about 2 hours and 15 minutes, compared to 30 minutes at an urgent care facility. Urgent care visits cost approximately $1,100 less on average than ED visits, and clinics and urgent cares are usually more accessible. Awareness and accessibilities are problems that lead to the behaviors of overutilizing the ED and needlessly increase the cost of care. My solution improves the patient experience by providing actionable information related to their care with financial benefits for all parties involved. Diverting non-emergent patients to alternate locations can reduce the patient's cost of care, eliminate extended periods in the ED waiting rooms, and reduce the time to see a clinician by accessing care at a closer proximity to the patient. My proposal is Smart Care Triage, which is a mobile video chat service that is a combination of telemedicine, dialing emergency services, and a nurse's hotline. Smart Care Triage assists patients before they get to the ED to only be confronted with long waits and higher costs. The service provides the patient with an immediate review of their illness and case by viewing and inquiring of symptoms. Dependent on the required care, wait times, and location, the clinician will provide a recommendation to go to the ED, urgent care, or other clinics, or write a prescription. Using proprietary technology, the service will also provide current wait times of healthcare locations nearest to the patient. Lastly, the service will send the recommended facility address to the patient via text and call ahead for pre-registration so the facility will be ready for the patient's arrival. Smart Care Triage focuses on facilitating the correct care at the correct cost. The system creates financial incentives that lead to responsible healthcare behaviors through awareness and accessibility. Insured patients placed in the call will receive reduced insurance premiums. Self-pay individuals receive immediate financial savings, especially with high deductible plans increasing, shifting the financial responsibilities to the patients. Insurers enjoy the program because they pay less for treatment of the same illness. Hospitals reduce ED wait times and resource burdens, allowing their attention to be directed to more acute cases. Urgent care and clinics benefit due to increase in volumes. These financial incentives align patients' behaviors that lead to the correct care at the correct cost. I'd like to review the business plan. Rerouting non-emergent care to alternate facilities has potential to save patient providers and insurers approximately $8 billion annually. There will be two marketing techniques employed. First, partner with the insurance providers that have an interest in limiting their customers seeking inappropriate and costly care. And second, directly online marketing via email ads, social media, and videos. At Smart Care Triage, I anticipate our first year revenues to hit $1.4 million. The first year of operations, we project a volume of about 20,000 calls at an average savings of $1,000 per call. We anticipate that 60% of our volume will come from private insurance, 30% from self-payers, and 10% from Medicare and Medicaid. The third-party payers will be billed at 7% commission of the savings, and self-payers will be charged an annual fee of $100. The cost of service is anticipated to be $1.4 million for the first year of operations. Salaries and benefits of registered nurses and doctors average at $170,000 each for 5 individuals comprise of the largest spend. Depreciation on assets would be $200,000 with approximately $7,000 in interest payments. Technologies and supplies will be about $50,000. Purchase services such as software development, internet marketing make up $120,000, and other operating expenses total $240,000. After taxes, first-year net income is projected to be $3,000 and $525,000 the second year, giving you a 2-year payback period based on a 150% volume increase to 51,000 calls. The third-year net income projections are $3 million based on a 200,000 annual call volume. One of the significant challenges we face is changing behaviors of those patients that use the Emergency Medical Treatment and Active Labor Act, which mandates that emergency departments must care for all patients who present to the ED regardless of their ability to pay. And our projected volumes currently don't include this demographic. Today, there are multiple services that present solutions to divert patients before emergency care, such as United Healthcare's Your 24-Hour Nurse, dialing 911, EDs themselves, primary care offices, telemedicine clinics, and urgent cares. And unfortunately, there's no coordination or clear direction from each of these parties that best matches the correct care at their correct cost. Smart Care Triage creates value and is differentiated by using our proprietary technology that optimizes care options, care costs, distances, and wait times, giving customers the best experience possible at the closest location, shortest wait time, and at the best cost. By year 5, we anticipate to have about 10% of the overall market. Sharks, action must be taken regarding the emergency personnel shortages, high cost of care, and improving the patient experience. I'm asking for a $100,000 investment for 20% of my company. Who's ready to partner with Smart Care Triage to improve the customer experience by providing correct care at the correct cost, all while making money? Thank you.